Diabetes is a chronic disease affecting 415 million people worldwide and is associated with 5 million deaths each year. Despite a prevalence of 9% or 1 in 11 people, nearly half of those with diabetes are unaware that they have this condition. If left unmanaged, diabetes can lead to severe complications such as blindness, tooth loss, heart attack or stroke, kidney disease, and nerve damage. In extreme cases, patients may require limb amputations. In Ireland, there are almost 250,000 people living with diabetes. Currently, €1.35 billion, or about 10% of the total annual Irish healthcare budget, is being expended on diabetes care. When we eat foods that contain carbohydrates, our digestive system breaks down these foods into a type of sugar known as glucose. Glucose is the primary source of fuel for our bodies. Once extracted from these foods, glucose travels throughout the bloodstream to each cell in the body. The pancreas is an organ located behind the lower part of the stomach, which plays an important part in diabetes. The pancreas releases insulin in response to glucose in the bloodstream. Insulin is the key hormone that allows our bodies to absorb and use the glucose that's broken down from foods. Glucose and insulin travel through the bloodstream to each cell in our body, for example, muscle cells. Insulin acts to allow glucose to enter the cells freely, where it can provide the energy source the body needs in order to function. A healthy body requires an optimal and regular blood glucose level. When cells absorb glucose from the bloodstream, the overall blood glucose levels drop, and so the pancreas stops producing insulin, as there's less need for it. When there's too much glucose in the bloodstream, we produce more insulin, which helps bring the blood glucose back down to normal levels. However, in the case of diabetes, the body does not have full control over blood glucose levels. This is because of either a lack of insulin or because the body does not react properly to insulin. There are two main types of diabetes, type 1 and type 2. In type 1 diabetes, the pancreas is unable to make any insulin. This is because of an autoimmune disorder, whereby the body destroys the cells of the pancreas that are responsible for making insulin. This lack of insulin means that cells of the body cannot take up glucose from the bloodstream. Type 1 diabetes is a lifelong condition that typically occurs in early childhood and accounts for about 1 in 10 cases of diabetes. Type 2 diabetes, the more common form of diabetes, is not insulin dependent, and the pancreas may produce some insulin. However, the amount of insulin produced may not be sufficient for the body to function normally. Additionally, the body may not respond properly to the insulin being produced, and again, the glucose cannot be taken up by the cells of the body. The reasons for this insulin resistance are not always clear. Type 2 diabetes typically progresses over a number of years and is associated with poor diet and lack of physical activity. Other significant risk factors include family history, increasing age, and ethnicity. In both type 1 and type 2 diabetes, glucose levels in the blood may become elevated above optimal levels. This is referred to as hyperglycemia. This glucose is only able to leave the blood by being filtered through the kidneys, which is why people with uncontrolled diabetes often need to pass urine more frequently than usual. Because the body is losing so much water, patients may be excessively thirsty. Also, because the body is not getting the energy it requires, diabetic patients may be constantly tired and hungry. Glucose levels can build up in the eye, leading to blurred vision. Patients can also experience weight loss as the body searches for other ways to obtain the energy it needs by breaking down stores of muscle and fat. In the case of type 1 diabetes, regular medication is required to replace insulin in order to maintain blood glucose levels at a safe range. Treatment for type 2 diabetes may be a little more complicated. The first step is often to encourage a more healthy lifestyle, including a balanced diet, physical activity and exercise, maintaining an appropriate weight, and cessation of smoking. However, most patients with type 2 diabetes will require medication in order to control their blood glucose levels. The majority of patients with diabetes today are aware of the importance of self-managing their condition. Patients can check and log their blood sugar levels regularly by using glucose monitoring meters. Newer devices can also be linked to various smartphone apps, which patients can then use to track their glucose levels digitally. This records valuable information to provide doctors with the most accurate data and allows diabetic management plans to be tailored to each patient's requirements. It's important to remember that being active and maintaining a healthy diet is extremely important. This should be at the forefront of prevention and management of type 2 diabetes, in order to reduce the risk of severe complications resulting from poor blood glucose control. Similarly, in type 1 diabetes, management of this condition should also include physical activity and a healthy diet.